Hello guys, this is Ada Ojide from Med Lectures Express, back with another daily med quiz on papilledema. This video will focus on a concise review of papilledema. Please review your text for more understanding. A 31-year-old female patient with a BMI of greater than 42 and chronic headache syndrome presents to your clinic with exacerbation of headaches along with GI disturbances such as nausea, vomiting. You perform a fundoscopic exam and note the following images. The image on the left. How would you characterize it? A. Cottonwool spots. B. Papilledema. C. Microaneurysms. D. Choroidal neovascularization. The key points in the question are italicized. To be successful in answering the question, you must know the following. What does the image signify or mean? What clinical conditions and possible etiologies cause this presentation? What is really going on with the patient? And the question stem is also trying to determine your knowledge on the abnormalities visualized during the fundoscopic exam. So basically, you need to identify what this retinal abnormality is. As previously mentioned, the key points from the question include the following. 31-year-old female patient with a BMI greater than 42. Chronic headache syndrome, exacerbation of headache, and GI disturbances such as nausea and vomiting. The best answer choice is papilledema. Papilledema just means the swelling of the optic nerve due to ICP, increased intracranial pressure. There is also hemorrhaging on the periphery. ICP results when the synergy between the CSF, blood, brain parenchyma, and cerebral perfusion is disrupted. The pathobiology of volume homeostasis in the brain is termed Monroe-Kelly doctrine. That's when everything works in synergy. Differential diagnosis of papilledema. Intracranial mass or tumor accounts for 28% of papilledema presentation. Acute subdural hematoma accounts for 16% presentation. Trauma accounts for 3.5% of cases. Meningitis accounts for 2.5% of cases. Primary pseudotumor cerebri, which is also known as idiopathic intracranial hypertension, accounts for a majority of papilledema presentation, more especially in obese women of childbearing age. It is a diagnosis of exclusion. Modified Dandy criteria is a primary diagnostic tool. It typically presents with headaches, with straining, visual disturbances such as diplopia, photophobia, pulsatile tinnitus, GI distress is common. Head CT, MRI, lumbar puncture helps to refine diagnosis. Lumbar puncture usually has a high opening pressure with a normal CSF. Treatment includes acetazolamide. Also, it's important to discontinue pharmacotherapy culprits such as OCPs, vitamin A, and amiodarone. There are other, just to name a few. Obviously, finding alternative therapy with these aforementioned drug culprits is also important. And last but not least, surgery for intractable papilledema and vision loss. This table, it shows the modified Dandy criteria, and you can use it as a reference. You can actually pause the video to review it. Now let's review the other answer choices. Cottonwool spots. Cottonwool spots are soft, white, fluffy exudates or lesions with fringe borders on the superficial retina. It is caused by arterial ischemia, blockade of axoplasmic transport, which is just a neuron transport mechanism, and axonal deposits of membrane-bound protein. Possible etiologies include the following: hypertensive retinopathy, diabetic retinopathy, Rocky Mountain spotted fever, neoplastic disease, SLE, ischemic optic neuropathies, microaneurysms. On your left, it's more high-def imagery. They're very micro in presentation. They're very minutia in presentation. Microaneurysms are tiny outpouching or hypertrophy of the retinal vessels that leak into surrounding retinal compartments. Possible etiologies include the following: systemic lupus erythematosus, muscular dystrophy, leukemia, lymphoma, diabetic retinopathy, hypertensive retinopathy, and so forth. The last answer choice is choroidal neovascularization. Choroidal neovascularization are new vessels that originate from the choroidal part of the retina. These are typically seen in patients with AMD, age-related macular degeneration. This results from overproduction of vascular endothelial growth factor. I really wanted to provide a lot of images of retinal abnormalities to enhance knowledge and for your reference. These images align with the answer choices, and you can pause the video to review it. We have papilledema, choroidal neovascularization, Cottonwool spots, and microaneurysm. Papilledema versus a normal fundus. This is papilledema on your left, and on your right is a normal fundus. The imaging just shows papilledema superimposed on a normal fundus, and it just shows you what a normal fundus looks like. This is an additional image of choroidal neovascularization, and on your right is a high definition resolute imaging for your reference. Imaging shows retinal abnormalities with diabetic retinopathy for your reference. On your left is a normal retina. On your right is a diabetic retina, and it has the Cottonwool spots, the microaneurysm, edema, and exudates, and neovascularization. Another imaging to enhance your knowledge. This image just shows different retinal abnormalities. You have hemorrhage, exudates, which could be which are Cottonwool spots, microaneurysm, and so forth. Use this as a reference to understand abnormal retina. Additional imaging of a normal fundus and a cup disc ratio measurement. This just shows you the normal fundus with the structures identified and the cup disc ratio. You can pause the video to review the images, and you can also use this as your reference. Thank you so much for watching. Bye.